I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. Today, I want to start with a simple question, but one that has silently troubled millions of men. Is my size normal? This question is flooding online forums, discussion groups, and even the offices of urologists. But unfortunately, most of the information you find out there isn't reliable and often causes more confusion than clarity. So, what is considered a normal penis size? And more importantly, how do you measure it correctly without misleading yourself through unrealistic comparisons? Before you start feeling anxious, let me reveal a scientific fact that very few people know, and it might completely surprise you. 95% of men who worry about their size are actually within the medically normal range. Yes, you heard that right. This video will show you that truth, clearly, backed by science, and help lift the silent pressure that's been weighing on your mind for far too long. In reality, most of the anxiety about size doesn't come from the body itself, but from the way we perceive ourselves, a phenomenon known as body image distortion. Many men believe they are too small, but that belief often comes from unrealistic comparisons, especially with adult films. In those, everything is exaggerated. The camera angles, the lighting, the carefully selected actors, and sometimes even digital enhancement. And so, you end up comparing yourself in a dimly lit bathroom to an image that isn't even real. The anxiety begins with the illusion itself. Here's something interesting that few people talk about. The anxiety around penis size is actually much more common among men than it is a concern for women. According to surveys, 55% of men report feeling anxious or dissatisfied with their size. But in contrast, only 5 to 10% of women say it's a truly important factor when evaluating a partner. What does that mean? It means most of the pressure you're carrying might not come from others, but from expectations you've placed on yourself. So take a deep breath. My goal in this video isn't to judge, it's to clearly explain, backed by science, how to accurately measure penis length and girth and avoid common mistakes. The truth behind enhancement procedures, how effective they really are, and the risks involved. And finally, a surprising historical perspective that may completely shift how you see the idea of ideal size. Let's get started. Now, let's talk about how to accurately measure penis size, because this is the foundation for understanding what's considered normal in medical terms. There are two key metrics to consider: length and girth, in other words, the length and the thickness of the penis. Length can be measured either when fully erect or when flaccid but stretched out. Both methods are used in research, but in clinical settings, measuring while flaccid and stretched is considered more consistent and reliable, as it closely correlates with actual erect length. To measure correctly, you'll need a rigid ruler or a non-stretchable measuring tape. Place the ruler along the top side of the penis, starting at the pubic bone, the spot where the penis meets the body. Important note, you should press gently into any fat pad to reach the actual bone. Then, gently pull the penis straight, not too hard but enough to fully extend it, and measure up to the tip of the glans, which is the head of the penis. This same method applies when measuring during an erection. Keep the ruler aligned with the shaft, starting from the pubic bone and ending at the tip. Warning, make sure not to measure from the skin or outer base, as this will give inaccurate and inflated numbers. Now for girth, this is just as important as length and varies significantly among individuals. To measure girth, use a flexible measuring tape or a piece of string. Wrap it around the midshaft of the penis, not too close to the base or the head, then mark the point where the ends meet and take the reading. You can do this both when flaccid and when erect, but in most scientific studies, erect girth is the standard measurement. Many men misjudge their own size, either because of poor measuring technique or because they compare themselves while not fully erect to others who are at their maximum. And that leads to distorted expectations and unnecessary self-doubt. Now that you know how to measure correctly, let's take a look at what real scientific data tells us. Backhand index pointing right, what is the actual average? Backhand index pointing right, and where do you fall on that spectrum? A large-scale meta-analysis was conducted, combining data from nearly 15,000 men worldwide. This type of study is highly reliable because it pulls results from multiple scientific papers to produce trustworthy global averages. So, what did the researchers find? Roughly 90 to 95% of men have a penis length either fully erect or stretched while flaccid. That falls between 10 to 16 centimeters, which is about 4 to 6.3 inches. The global average erect length is 13.2 centimeters, just a little over 5 inches. So, if you're somewhere in that range, rest assured, you are medically and statistically completely normal. You're not too small. And you absolutely don't need to chase some unrealistic number to be considered a real man. At both ends of a size spectrum, medicine offers clear definitions of what's considered too small or too large, and I want you to know these numbers so you can understand this. The vast majority of men do not fall at either extreme. Medically, a penis is considered small if its length, when erect or fully stretched, is less than 7.5 centimeters, or about 3 inches. On the flip side, a penis is considered very large if it measures over 24 centimeters, or more than 9.5 inches, and these cases are extremely rare, representing only a tiny fraction of the population. Now, what about girth or thickness? Just like length, penis girth can vary significantly from person to person. According to research, here are the typical numbers. Flaccid and stretched girth usually ranges from 8 to 10.5 centimeters, about 3.1 to 4.1 inches, with the average being 9.5 centimeters, or 3.7 inches. Erect girth tends to fall between 10 and 13 centimeters, or 3.9 to 5.1 inches, with an average of 11.5 centimeters, or 4.5 inches. So if your measurements fall within these ranges, you're not just normal, you're actually part of the overwhelming majority of men around the world. So when someone talks about average size, backhand index pointing right, these are the actual numbers they're referring to based on real scientific data, not guesswork or feelings. Unfortunately, many men compare themselves to completely unrealistic standards, especially those portrayed in adult films. Movie camera in those, the actors are often handpicked for extraordinary size. Not to mention all the camera angles, lighting tricks, and even digital editing that exaggerate perception even more. Lightbulb, the takeaway is simple. Backhand index pointing right, if you fall within the 10 to 16 centimeters range, you're well within the normal range. And even if you fall outside that statistical curve, it doesn't determine your health, your manhood, or your worth. But before we move on, I want to share something very important. If you've ever felt a lack of confidence, if you've noticed changes in sensitivity, desire, or stamina in the bedroom, pushpin, you need to know this. It's not your fault. And you're not alone. In fact, there is a 100% natural solution, no pills, no injections, that has quietly helped over 63,000 men regain their confidence, firmness, and that rock-solid performance. Backhand index pointing right, it's a simple 7-second technique you can do right at home. It works by activating a key biological molecule that scientists call the masculinity molecule, a major driver of blood flow and erectile stamina. Now, let's continue, because the next part covers a topic that more and more men are becoming curious about. Is it possible to enhance or change the size of the penis? This curiosity is completely normal. Everyone has the right to understand their body and seek solutions if they're feeling insecure. However, and this is very important, you need to know how to distinguish between legitimate medical information and exaggerated, unverified advertisements. One of the most common aesthetic procedures today is increasing penile girth, meaning adding thickness, not length, to the shaft of the penis. The most widely discussed method is hyaluronic acid injections. Hyaluronic acid is a naturally occurring substance in the body, and it's commonly used in cosmetic fillers, such as those for smoothing wrinkles or plumping lips and cheeks. Nowadays, it's also being used to increase penis girth by injecting it along the shaft. Pushpin. According to medical reports, hyaluronic acid injections can temporarily add 2 to 3 centimeters in girth. The effect typically lasts 12 to 18 months, depending on the product used and the individual's metabolism. The biggest advantages of this method are relatively high safety compared to other materials. The body can gradually absorb the filler over time, leaving no permanent foreign substance in the tissue. However, this is still a medical procedure, and it should only be performed by qualified doctors, using products with verified, safe origins. However, not all injectable materials are safe. Some clinics, especially those lacking proper credentials, have been known to use non-absorbable fillers such as PMMA, polymethylmethacrylate, or even industrial-grade silicone. And this is extremely concerning. These substances are not biodegradable, meaning the body cannot break them down naturally. Over time, they can lead to serious complications, including chronic inflammation, hard lumps or nodules under the skin,
penile deformity,
and most importantly, permanent tissue damage that cannot be reversed. For this reason, reputable medical organizations around the world do not recommend the use of these materials in any form of genital aesthetic procedure. What about procedures to increase penis length? Compared to girth enhancement, lengthening procedures are far more limited in effectiveness and carry higher risks. Currently, there are two main techniques, but both must be understood carefully. Pubic fat pad liposuction. This procedure removes excess fat from around the base of the penis, which can make more of the existing shaft visible. It does not actually lengthen the penis, but it may improve appearance, especially in overweight men. Suspensory ligament release. This is a surgery that cuts the ligament attaching the penis to the pubic bone. In some cases, it may increase visible length by 2 to 2.5 centimeters when the penis is flaccid or stretched. However, there's an important caveat. It does not increase erect length and may cause instability during intercourse, increasing the risk of injury and scar tissue. More importantly, no method to permanently lengthen the penis has been certified as safe and effective by major medical bodies. Neither the Brazilian Federal Medical Council nor most international health authorities endorse these surgical methods as standard treatments. And finally, a very common misunderstanding. You may have seen penile implant ads online, but here's what you need to know. These implants are not for size enhancement. They are medical devices designed to treat erectile dysfunction, used only in severe cases, and never recommended for cosmetic purposes. Before we wrap up, I want to share a fascinating historical perspective, something that might completely change the way you think about the idea of an ideal size. Let's take a journey back in time to ancient Greece, the birthplace of Western philosophy, art, and science. You might be surprised to learn that in that culture, the ideal male form was not associated with a large penis. In fact, a smaller penis was seen as a symbol of intellect, self-control, and rationality. By contrast, a large penis was often associated with barbarism, lack of discipline, or unrestrained lust. Don't believe it? Just look at the statues of great gods, heroes, and philosophers, from Zeus and Apollo to Socrates, and you'll notice something. None of them are depicted with exaggerated anatomy. When large penises do appear in classical art, they are usually meant to be comedic, satirical, or connected to mythological figures like Priapus, the god of fertility, deliberately portrayed in a grotesquely exaggerated way. Backhand index pointing right, what does this tell us? It reveals a simple but profound truth. The idea of what's normal or ideal in size is not fixed. It changes with time, culture, and social context. And that's why your worth is not defined by a number. It's defined by your confidence, your health, and the respect you show to your own body. And why does this matter? Because it reveals something simple, yet deeply important. Backhand index pointing right our ideas about masculinity, size, and what makes a real man are not universal truths. They shift over time, across cultures, and are often shaped more by media narratives than by science or biological reality. What was once considered ideal in ancient Greece could be the complete opposite of today's manufactured standards. And that means, if you've ever felt insecure, pressured, or not man enough just because of what you saw online, in adult films, or overheard in locker room talk, you are not alone. But I truly hope that after watching this video, you're seeing things with more clarity and understanding that push-pin penis size does not define your worth. It does not determine your attractiveness. It does not dictate your ability to satisfy a partner. And it certainly doesn't define your masculinity. What truly matters is the confidence that comes from accurate knowledge, the way you care for your mental and physical health, and the respect you show to yourself and to others. If you found this video helpful, don't forget to like, subscribe to Men Health 30, and turn on the bell so you won't miss more honest, science-based, and judgment-free content like this. Thank you so much for watching. I'm Alice, and I'll see you in the next video.